Hi, Nick here with MedTech World. We have Mr. Dublat here with Robeaute, right?
Yes,
You just
absolutely.
came off stage, you had a talk?
Yeah, I had the talk this morning and it's great. I'm very happy I was able to present here.
Cool. What do you think of this particular place to
It's
present within?
incredible. It's incredible. We started Robeaute at Hôtel Dieu, which is a very old, ancient hospital in the middle of Paris, in front of Notre Dame. And so there is an echo to be in this historical hospital also.
Not fitting.
And it's very humbling and very impressive. It's a beautiful place also.
There you come to a hospital environment with quite a sophisticated product, Robeaute.
Absolutely.
Within the body, yeah, but it's capable of delivering, testing, sensing.
Yeah, we were developing a neurosurgical microrobot to get into the brain parenchyma, in the hard matter of the brain, and being able to move in following 2D and 3D curves. Whereas today, when neurosurgeons get into the brain, they can only move in a straight line. And going in 2D and 3D to follow the curvature, the circumvallations of the brain in order to sense with sensors and deliver drugs based on data that comes from the sensors and potentially monitor for a while all the patients going. Of course, it's for hardcore pathologies.
Sure. I'm learning that the brain-blood barrier is preventative in terms of medicine or any kind of access to the brain. So direct, this is the new challenge, is to get to the brain
Exactly. The thing is that to intervene in the brain for cancer, for a neurodegenerative disease, you don't have so many ways to do. One of them is drugs, but unfortunately you will flood the whole body, all the organs, and get very little drug in the brain because of this blood-brain barrier that filters for the brain. And so that's one way of circumventing this issue, to directly get into the brain. The other way to get into the brain is through the vascular system, through the veins. But then you're on the wrong side of the blood-brain barrier again, and so you are not you're in the brain, but you're not in direct connection with the neurons and with the cells that you want to take care of. It's very useful for strokes and vascular event, but not so much for anything that involves the neurons. So that's where the microrobot fits and goes through the brain through a very tiny hole and is able to do everything I mentioned, sensing and treating and monitoring.
How useful would this event be for your product and the offering? How have people been receptive to it, the idea?
Yeah, it's a very interesting event for us because it has both MedTech professionals and investors, who often are MedTech investors also. And so it's a mixed community that can understand what we're doing and where we see a lot of potential discussions, even collaborations, and sharing ideas, sharing network, reconnecting with people that we know. So that's fantastic. And the ability to present here today was very special also for Robeaute, because we've started our preclinical trials on live animal models only this summer, and it was the first time that we presented this, and it's really a step forward for us in terms of getting the microrobot to treat actual patients.
Sure. And today and yesterday, it's a step forward for Robeaute.
Yeah, it is. It's clearly a very interesting and important moment where we get into the real work of not so much putting together the microrobot, but actually using it in brains.
Cool. And the real work starts again on Monday morning, right?
Yeah, of course, every week. And
I hope you enjoy the rest of the event. Bertrand,
thank you very much
very much for joining us at MedTech.
Thank you very much.